Hello, my name is N. Gopal Naidu. I am a retired officer from State Bank of India. The present age of mine is 64 years. Actually, I developed some problems regarding heart some 2 years back. I was actually going around various doctors to consult them and take proper treatment, but I was not very sure whether they will be able to give me safe and proper treatment. In the meantime, after retirement, I settled down in Miapur about 2 years back. So we noticed that in one of our reading about newspaper information in Inadu monthly weekly magazine, they wrote about KIMS Hospital. They wrote about the founder of the KIMS Hospital. They wrote about the ethics and the practices followed by the KIMS Hospital. I was so much impressed by their standards of medical treatment to the people of suffering in nature. And then I was moving around in Madhapur area and I saw KIMS to my surprise, and I was so happy and thrilled to take the services from KIMS from then on. Actually, I was visiting KIMS from almost 2012 onwards, and every time I come here, I get good information, good treatment. I used to go away. But then, as I was telling you, that I developed this problem. This problem, in fact, Dr. Ravi Kumar, when I went with my reports, I came to consult him. I went with my reports to him, and he said, "You better undergo angiogram immediately." I was little puzzled in the sense angiogram is a very serious matter. It may interfere with your health and then it will create problems for you. So I almost ran away from the doctor. Again, couple of months or maybe 4 months, 5 months, I was having this problem again, and I visited once again. He again said the same thing. So I understood that this is a serious problem. But then I didn't have the courage and readiness to take up even angiogram. So finally, my daughter, who was in USA, had to be here, and then she forced me and took me to one hospital, and there they performed angiogram and they said there are blocks in our heart. That was around 8 months back. Even then, I was not ready to take up their suggestion to undergo bypass surgery. In the meantime, I was actually taking some other doctor's advice, some medication. When intermittently I used to come to KIMS Hospital and once again check my TMT. Of course, under doctor's name only this was done. The reports are printed in his name because I am a consultant. I am consulting him for the long time. So every time I see this report, I feel that it is to be undergone like this. So finally what happened was, on 17th of October 2016, I developed some pain in the chest. That pain, normally I used to get pain when I take some Gelusil or some antacid tablets, that pain will go away. So I was associating this pain with gas problem and it may not harm me in the heart itself. But then later on, that day this problem came, the pain persisted in spite of taking antacid tablets and then taking hot water, and for the whole day it did not subside. It was coming. That night I slept well, but early morning 4 o'clock again that sensation was there. As the morning is growing, that is, as it was becoming daytime more and more, then my trouble has also gone up, the pain has gone up. So I decided actually to consult the doctor. Actually, Dr. Balamurali Krishna was actually, I was thinking of meeting him on the 17th itself, because I was suspecting this is a gas problem. I called up KIMS at 4:30. They said Dr. Balamurali Krishna has left the hospital. So I said, let me stay back, and next morning, as the pain persisted, I had to come to KIMS in a rush. Actually, I did not plan well. I did not plan at all. So I came. Then I was admitted in the emergency ward, and then they verified and confirmed that this is related to heart only. Just at the time I was in the emergency, I remembered an old classmate of mine, a classmate who parted ways with me in 1973, and his name is Balramaya. And another person of our class is Mr. Sinaya. These two people were there, and we are very good people, good friends at that time. After that, we have lost touch with each other. But later on, only recently, 7-8 months back or so, there was a old student meet, and I could not attend that because of my heart issue. Some of my other friends in Hyderabad attended that program, and one of them, when he was talking to me, he mentioned about Balramaya. Balramaya number also he gave me. I said I will talk to him. Anyway, after coming to the bed in the emergency in KIMS, I called him up. I called the number. Immediately he took, and he was not able to recognize me. But then I introduced myself. Then he said, yes, we know each other. Then I told him my problem. Then he said, I came to know that you are known to somebody in hospital, KIMS hospital. Can you tell them, put in a word so that proper treatment is given to me? He said, immediately I will do that. And then within 5 minutes, he called me back and said, no, Dr. Bhaskar Rao is my relative, but he is trying to locate you, but you are not available to him. I mean, he is not able to locate you in the hospital, so you better call his number. And he gave me the number. That number I took and called him. He just took the call and said, you be there, I'll be seeing you at 2 p.m. Same day. Then I thought, okay, it's good, something is happening like this, so let me continue. So I was in the treatment. Then they shifted me to the emergency ICU. The treatment has started, and Dr. Bhaskar Rao came at 2:30 time, at 2:30 p.m. I was really surprised and shocked that a person of that stature, a founder of this hospital, could find time to come and see a person not known to him at all. So Balramaya's words simply proved 100% true, and whatever I read about him in the newspaper about the hospital and things like that, he came very pleasantly. He talked to me, consoled me, and said, don't worry, we'll take care of you. That's all. Within no time he went away, and I did not talk much. I said, it's very impressive to see you, sir. Then after some time, Dr. Nisarga, I have not seen his name. Though I was visiting KIMS hospital for so many days, I was only seeing Dr. Ravi Kumar, Dr. Ravi Kumar, and then going away. So he came and started telling me that you have some problem, so please explain to me. So he asked me to explain about my condition, which I started telling him, and then he kept on answering me, kept on telling me. The way he spoke, the clarifications, the patience, the kind of clarity that he was passing on to me through his explanation was so amazing. I just did not have that fear of undergoing second time angiogram, and then maybe as I was hoping that this may not be the same condition will prevail like last angiogram, that is 50 to 60% blockage. But his words made me quite at home, quite relaxed and comfortable. So after that I went further test, that is on 18th. They carried out the angiogram and told my relatives, my wife and my relatives, that the blocks have gone up because they have seen both the angiograms, previous angiogram and present angiogram, blocks have gone up. Therefore, it is necessary that you should undergo immediately surgery. That was the impression given to me. After some time, I think another day or so was over and I was under treatment. Dr. Nisarga came again and started again explaining the procedure. Now we have come to know the truth of your heart condition through the angiogram done here, and now what is to be followed I will explain to you. He explained to me in a very lucid manner and asked me to raise as many doubts as possible and clarified them very vividly, clarified them with a lot of confidence. So that person's approach to the patient was something amazing. So that actually prepared me take up to undergo this operation. Then he told simultaneously that we have planned on Friday. Dr. Bhaskar also will be there with me. So we will perform the surgery for you. Is it okay for you and all that, he said. Then after all this is over, then I said yes. Now my first fear of falling into hands, which I have seen, number of cases I have seen, the commercialization of the health aspects by hospitals, and money is not the issue. The issue is one's life is the issue. So how hospitals are doing this was a great tragedy to the humanity. I therefore felt that when Bhaskar Rao is going to be there with the surgeon while performing this bypass surgery, what more I can ask for? So I was very, very happy, very relaxed. I was felt blessed actually. When these two people have become a team to do the operation for me, I felt I was blessed from the God. Nothing short. In fact, this, I don't know whether it is preceded or this preceded, I called once again Balramaya. They told me that I have blocks there in the heart. I have to undergo bypass surgery. Can you put in a word to Bhaskar Rao so that he also, is there around, and because I heard that he is also a cardio surgeon, cardiothoracic surgeon. So he said, no, don't worry, he will take care. That's it. I did not discuss further. I just took his words, and after the operation is over, I was brought to I did not know what happened later. Then my wife told me, Dr. Bhaskar Rao, in fact, was present there, which I did not hear from Bhaskar Rao, which I did not hear from Mr. Balramaya. Only Dr. Nisarga told me that Bhaskar Rao will be present while the operation is performed. So that word was so absolutely implemented. I was so happy and relaxed. That was the anecdote about my heart surgery. Heart surgery, as I understood, for doctors' fraternity, this may not be a very serious matter, but for ordinary people like me, though I am well qualified and all that, but in the field of medicine, I have no knowledge about it. So the fear of life, the fear of the family, so all that play a greater role. After the operation was over, I became conscious. Dr. Nisarga and Dr. Ravi Kumar, they visited and told me about facts. In fact, to tell you frankly, more information was passed on to my wife and relatives than to me, and I heard from them. Such was the commitment of these two doctors, that they should be comfortable, the patient should be safe and healthy. Therefore, I felt that it is a wonderful organization, as predicted, as informed, as written by the Intra-Aortic weekly magazine. It has really come to true, and I hear that this will be a greatest service from KIMS to the humanity around this place. And regarding KIMS hospital here in Kondapur, apart from Dr. Nisarga and Dr. Ravi Kumar, all others, they are doing exceedingly well. They are taking care of the patient. The cleanliness is excellent, up to date. Every day they take care of the patient. Whenever midnight, 4 o'clock, one night I was feeling hungry at 4 o'clock. I did not know what happened, but 4 o'clock that sister immediately arranged for bread and milk, and she fed me in that condition. So such kind of arrangements are really wonderful. They are going to serve this people who are suffering, and this hospital, I think, should grow from strength to strength, many more years to come, and cater to the needs of the suffering people. As I was mentioning you, that my wife and relatives only live here in this area, and I have two daughters who stay in USA. So they were such short notice, they could not make it to come to India. They were very much disturbed by this condition, so they were actually wanting to know information about what is happening to me and things like that. So incidentally, one of my friend who is a neighbor to me, who was almost like a son-like person to me, he took care of me during these kind of necessities, attending to hospital requirements, payment of money, and arranging some certain things for me and also the hospital. So he was luckily available with a phone, and he called my daughter to inform soon after the operation. As I was telling you, this boy, whom I feel as if he is a son of mine, helped me in every aspect of my treatment. And this boy luckily had a phone to connect my daughter in USA. She was actually worrying about my condition. If she wants to know the latest position about my system, of course whatever people around me tell her only will be available. But then at that moment, when Dr. Nisarga was explaining, after the operation is over, Dr. Nisarga was explaining about the operation to the people around my wife and my relatives. This boy gave the phone to him, a video call was there, and Dr. Nisarga took interest, so much of interest, to explain it further for her satisfaction and making her so much comfortable. In fact, she came to Hyderabad after 2 days, that is 21st was the operation. She came here on 24th, I think so. 24th, actually she wanted to come and meet him personally and thank him profusely for the kind of concern, for the kind of clarity, for the kind of information given to her as well as to my family members. And I am extremely thankful to the KIMS administration, the KIMS hospital staff, and the leader behind the entire hospital group, Dr. Bhaskar Rao. Hats off to his commitment to the humanity. Money is another thing, but humanity is something which is God sent. So he is really taking care of that aspect of it, and I am sure you will spread this message forever in the days to come, not only through his own thing but his institutions. He should grow well, and then they will become serving tools for the needy people. So I thank again Dr. Nisarga, the chief cardio surgeon, and the cardiologist Dr. Ravi Kumar for their able and committed, concerned with humanity and also for my treatment. I thank the administration again and again. I hope people will see this my episode. My episode is a small episode. There may be hundreds of episodes like this. Probably you may not be coming to know, but simple episodes like this will give you enthusiasm, confidence, and go ahead with the treatment from KIMS hospital administration. So I thank the administration again, and Dr. Bhaskar Rao, and Dr. Nisarga, and Dr. Ravi Kumar, and all their staff, because each one is very important. Each one has to play their role so that the ultimate product, the ultimate service is given to the patient is fulfilled in a appropriate manner. My daughters, both of them who are in USA, are extremely thankful to Dr. Nisarga for his. It is one thing to do an operation and leave it, but it is another thing to give the confidence to them that this has been done, this is been done, this is how it is, and it helps, and that is a wonderful thing that carries the people along and gives them all the confidence that they require. Thank you so much.